And welcome. My name is Laura File, and I'm a success coach and academic advisor here at UAGC. I will be the host of this session, a handbook of complementary and alternative techniques for stress reduction. By joining us today, you are acknowledging that this session is being recorded and will be shared with TLC related materials. Microphones will be muted for this presentation, but we encourage you to post questions and comments in the chat. Also, we have enabled live transcription. If you would like to use it, click the live transcription button at the bottom of your Zoom window. Now, I'm pleased to introduce you to Dr. Marie Pangilinan. Take it away. She's a
Thank you.
health and wellness coach.
Thank you. Hi, everyone. Thank you for joining me today. My name is Marie Pangilinan. I just recently graduated from the University of Arizona Global Campus with a PsyD. I completed my applied doctoral project, a handbook of complementary and alternative techniques for stress reduction. I decided to pursue and conduct a basic literature review and create a digital handbook of complementary and alternative non-practitioner-based techniques for stress reduction. Pursuing the research topic of stress and ways in which stress can be combated through the use of complementary and alternative techniques. The literature review answered three important research questions. These questions included, what are the damaging consequences of stress? What are the most effective non-practitioner-based best practice complementary and alternative practices for stress reduction and management? And how could an online handbook be used to help individuals reduce and manage chronic stress? The handbook was designed to address stress as a global health crisis, increase awareness of various types of stress, and foster a variety of ways to improve health behaviors and activities. A brief overview of the literature includes and defines health psychology as it aims to promote and maintain individual health to prevent and treat illness. The historical context of stress, including stress, both good and bad stress, and the stress response. Also defining complementary and alternative techniques, which include biologically based practices, energy medicine, relaxation techniques, and green space. Also included within the literature review include the negative effects of chronic stress. As you can see, it includes a plethora of problems like cancer, heart, lung, liver disease, suicide, impaired immunity, stomach problems, inflammation, decreased performance, lower levels of productivity, and problems with mental health. Also, studies indicate that stress is often a result of physical, mental, social, emotional, and spiritual, as well as financial pressures. The literature review was conducted based on the conceptual framework of Albert Bandura's social cognitive theory. Bandura believed that personal efficacy could help assess individual ability to initiate coping behaviors, consider the amount of effort exerted, and how long efforts are sustained in the process of obstacles or adverse experiences. Albert Bandura's framework supports individual motivation and behavior change for improved quality of life and stress reduction. Research materials for the literature review was derived from existing literature and focused primarily on the topic of chronic stress, as well as complementary and alternative medicine. All of the research studies were both current and relevant, for the exception of a few historical articles, and addressed research project questions within the literature review. The literature was collected from systematic reviews, meta-analyses, cohort studies, case studies, and also include gray literature. Other sources included material from the CDC, HHS, as well as the NIH. The research results indicated that there was a greater need to further expand research studies on complementary and alternative therapies for stress reduction. Further expansion of research studies would increase opportunities for individuals to receive access to complementary and alternative therapies that are more evidence-based and will support the need to develop more effective health-promoting interventions. It will also decrease the gaps in scientific evidence-based literature. Limitations in regard to the research results include the gaps in the amount of evidence-based research regarding complementary and alternative medicine, and the amount of information regarding how these techniques may or may not directly affect adult individuals suffering specifically from chronic stress. Finally, the project itself could be more quantitative in the future when the handbook is made live for public use and or distributed amongst the public, and reveal more information regarding the use of the handbook by individuals suffering from chronic stress. There are many things that I learned from the outcomes of the literature review. My field of study contributes to the field of study by creating a deeper understanding of current knowledge on the types of stress and the negative effects of stress among individuals within a global society. Furthermore, the study fostered and increased the knowledge base on current non-practitioner-based versus practitioner-based complementary and alternative techniques for stress reduction. Finally, incorporating only non-practitioner-based complementary and alternative techniques into the handbook, which were all evidence-based techniques, enables individuals with the ability to discern the difference between the different types of techniques and better decide which techniques may or may not suit their lifestyle and or improve their health behaviors according to their goals. The handbook. The handbook is entitled Healing Matters: Relaxation Techniques to Manage Stress. It is a health psychology intervention aimed at reducing stress, its negative effects, and complementary and alternative practices that help to eliminate stress and improve one's quality of life. The handbook objectives are intended to offer hope for recovery for individuals suffering from the negative symptoms of chronic stress. Also, I aim to educate individuals about stress and complementary and alternative therapies that are available to individuals to reduce the symptoms of stress at their own time and leisure due to the fact that they are non-practitioner based in nature. Also, my goal was to provide a basic understanding of stress, describe the negative symptoms of stress, and improve ways in which individuals respond to stress. What is stress? As stated above, the literature included the different types of stress. So what is stress? Well, many people think that all stress is bad stress. The good news is that there is good stress. Good stress or eustress is a type of stress that helps individuals thrive. Eustress results from positive challenges or exciting experiences. On the other hand, bad stress, otherwise known as distress, is considered a state of challenged homeostasis. Bad stress is a result of high levels of stressors. And these stressors may prompt a severe stress response, compromise homeostasis, and threaten individual health and wellness. Research indicated that stressors are the driving factors that can directly change a person's homeostasis. As a result, the stress effect occurs. The relaxation response, on the other hand, is the opposite of the stress effect. The stress effect is a biological consequence of a struggle with chronic stress. Through the use of this handbook, it was hoped that complementary and alternative techniques and other guiding factors included within the handbook can help aid individuals to better learn how to manage and respond to stress and the daily stressors through the relaxation response. Coping with stress. How do individuals cope with stress? As mentioned above, it is extremely important for individuals to respond appropriately to stress. And because stress can cause havoc within an individual's life, it is also essential that individuals have the opportunity to know how to better manage their stress before it gets out of hand. A major goal of the handbook was to help individuals manage their stress and reduce stress. My research indicated that managing stress will ensure a healthier, happier life because everyone experiences stress at some time and during their life, and how an individual chooses to handle the stress determines the impact of the stress. Some important questions that I considered to help identify stress levels included: do you suffer from low energy? Do you suffer from aches and pains? Do you have insomnia or sleepiness? Do you feel overly emotional? Has your appetite changed? Are you feeling less social? Is your thinking cloudy or unfocused? Or how has your appetite changed? My research emphasizes that evidence-based relaxation techniques for stress reduction can help to reduce the mental, physical, and emotional tensions, as well as invoke the relaxation response, replacing negative feelings caused by stress with a sense of peace and calm. In addition to the evidence-based relaxation techniques provided within the handbook, other necessities for combating stress include self-care, adequate rest, regular exercise, and proper nutrition. These important ingredients are essential and are recommended to combat everyday stressors. Self-care includes nurturing your body, mind, and spirit. Proper nutrition requires that individuals maintain a balanced diet, stay hydrated, and avoid smoking, drugs, and alcohol. Regular exercise helps individuals to relieve stress, tension, and improve their sleep. Finally, adequate rest is important because it can help individuals reduce stress and anxiety while improving overall health and wellness, as well as provide pain relief. As noted above, the stress effect can become battled through the relaxation response. The relaxation response refers to the inborn capacity of the body to enter a deep state of relaxation. Mastering and utilizing the relaxation response decreases the heart rate, blood pressure, increases oxygen consumption and levels of stress hormone, and decreases stress hormones. Herbert Benson applied something called the faith factor. The faith factor was a tool incorporated into the handbook used for stress management. When Herbert Benson applied the faith factor, he considered an individual's insight, perspective, and meaning of experience. According to Benson, the relaxation response, referring to the inborn capacity of the body to enter the deep state, and using that faith factor, which was non-denominational, enabled individuals to enter into that state of relaxation. The relaxation techniques utilized within the handbook that were found to be evidence-based complementary and alternative relaxation techniques include autogenic training, autosuggestion, mental and guided imagery, meditation, deep breathing, and green space. And as I've mentioned, these are all non-practitioner based techniques, although each of the techniques could be used under the supervision of a licensed practitioner. And it is also suggested, as I will talk about later, to consult with your physician before beginning any type of complementary and alternative technique. So a little bit on green space. Um, Green space is when an individual engages with nature, also known as green space. It helps an individual's psychological and physiological health across the lifespan. Green space interventions may also mitigate cortisol production, reduce physiological stress for persons across the lifespan, and are essential for overall health and well-being. Excuse me 1 second. Precautions for the as I had mentioned, precautions are important, and also most important are considering pregnant women, individuals with osteoporosis, severe arthritis, any kind of active infection, um, individuals taking blood thinners or with bone fractures, also with connective tissue disorders. Anyone with serious medical conditions should always consult a trained and licensed practitioner. And just a little bit on each type of technique. Autogenic training is a complementary and alternative relaxation technique that utilizes the power of the mind and the body to relax. Autogenic training, although safe, is not recommended for individuals suffering from psychotic conditions. The technique can improve overall health and wellness and relieve symptoms of stress while increasing resilience to stress, anxiety, fatigue, and also improve pain management, reduce insomnia and irritability. Autosuggestion enables individuals to improve the cognitive and psychological states. It is a technique that is used to induce perceptual states and uses positive affirmations. Sometimes you'll see meditation beads in the hands of people who use this technique. The mantras or positive affirmations are repeated constantly and silently within the mind and heart until embedded within the subconscious mind. It can be used to improve health, aid in any healing process, decrease illness and disease, as well as support positive relationships or career changes. Mental and guided imagery is used to create a mental representation of an object without sensory input. It is designed to remove disturbing memories, replace disturbing memories, and instill instead positive mental imageries. Meditation enables individuals with the ability to relax, taking the active mind into a state of the silent mind. It also fosters a high degree of well-being that individuals describe as a state of calm, peace, or blissfulness. The body becomes deeply relaxed, and this enables the body to the blood pressure to be decrease, as well as reduce stress, anxiety, depression, and anger. It's also used to combat addictions like drug, alcohol, and cigarette use. Deep breathing and diaphragmatic breathing is the relaxation technique based on the notion that the mind and body integration produces a deep state of relaxation through that deep breathing. It amplifies blood oxygen levels, massages inner organs near the optimum, and can stimulate the vagus nerve.
We do have one question, and I just wanted to let you know we have about 10 minutes. So I
Okay.
wanted to let you know, just to continue,
Oh, sure.
unless you want to address the question, that's
Sure. No,
okay.
I can address. I
Okay.
can address the question.
The question was from Marie Henderson. Would the beach be classified as a green space because it is nature?
I would definitely say absolutely, hands down. We have the seaweed. That's green enough for me. I oftentimes in my coaching, I do health and wellness coaching, always refer to the beach. It's just everything for me. It's the the unpredictableness of the ocean water versus like the calming of the water, the sand, the sun, everything. So for me, it is like the optimum green space. So the answer to that is definitely yes. Um, so I created the handbook with the intention of fostering hope among individuals with chronic stress who may have feelings of despair and or hopelessness, whether it's acute or chronic stress, and if they're experiencing these symptoms on a regular basis or just here and there. When dealing with the symptoms of stress, it could be very difficult, and sometimes people fall into that hopelessness and despair. In the future, I would love to see this handbook distributed within healthcare facilities and psychiatric offices, for individuals to know that there's a ray of hope, or a silver lining, or a door to a different style of healing in in union with the allopathic medicine that they're being treated with, so that they can have the opportunity to know that there are other types of therapies, complementary and alternative therapies in this case, that can aid in their recovery process. I just want to thank everyone today for joining me. My contact is listed here, as you can see. If you have any questions, you can definitely email me, or you can check out the Handbook of Complementary and Alternative Techniques for Stress Reduction, which is published on the ProQuest platform as open access. And thank you again. I'll give Laura the mic. If you have any questions with the time we have left, I'd love to answer any questions. Thanks again.
Well, thank you, Dr. Pangilinan. It was fabulous. You were great.
Thank you.
And thank you for answering that question. It was actually in my mind too. I was thinking the beach. So we want to thank you. You were fabulous. And I saw there was another comment, and it was a great comment as well. So just bear with me and I'll read that to you. I would like to read one more time that it's the email for our wonderful speaker, lovely and wise at gmail.com. And your phone number is on there. So if you don't mind, I will give that as well.
Sure.
732 area code 773 7548. And the Handbook of Complementary and Alternative Techniques for Stress Reduction is published on the ProQuest platform as open access. Okay. So somebody was having a hard time hearing me. So I don't know if my microphone is maybe turned down. I apologize. I don't know if that were the case. Um, is this a little better? Speaking up a little more. Can you hear me now? We sound like that commercial. Is there any? Yes. Okay. Thank you, Dr. Peterson. And there was another comment that they cannot wait to download your book. So thank you
Oh,
for that.
thank you so much.
Uh, yes. Is there any other questions? I'm looking at the time. It's, um, I believe, 12:24, and that would be Mountain Time. So we have about what, 5 minutes, Ryan?
Laura,
Oh,
we do have one additional
question.
question,
Yes, I
Dr.
see that.
Taylor.
hmm So
What were
we
some
will.
challenges in finding evidence-based, non-practitioner-based techniques?
There were many challenges due to the fact that there is not a lot of um, evidence-based research specifically for stress reduction. A lot of the research that I had found was for other ailments, like cancer, or um, it could be anything, but specifically I was looking for stress, and I had come across finally, my research led me to the um, most evidence-based relaxation techniques, which were complementary and alternative health. And then from there, I chose the non-practitioner based, because there are evidence-based complementary and alternative techniques, which are both practitioner based and non-practitioner based. And so deriving that non-practitioner based was due to the fact that my focus and my passion is for work-life balance, and I wanted to provide society with something that they could learn about and master on their own. And if they needed to contact a licensed practitioner, then they could do so in their own time. Thank you.
And thank you very, very much. We got a fantastic information. Thanking you again. And is there anything? I think we're just about at time, Ryan, correct? I don't know if we have time for one more question, if there's a final question that anybody would like to ask. I don't see anything in the chat as yet. And don't forget about the contact information and downloading ProQuest for the handbook. If you want to put that slide up one more time so everybody sees it, that would be great.
I'm just I'm a little nervous to go backwards because it may.
Oh, okay. No worries. Don't worry about it then.
Okay.
We can give out your email again if you wish, since I don't
Sure.
have it in front of me
Yeah.
at the moment. Would you
Okay.
mind doing that?
Lovelyandwise@gmail.com. And it is a handbook of complementary and alternative techniques on ProQuest, open access.
Thank you. You did great. There was a lot of very valuable information today.
Thank you so much.
And I don't see any other questions, just very positive comments, because you did so well. And this is such important information.
If I have a minute, what are some of today? Can I hear some of the comments? I can't see them.
Oh, sure. Fantastic information. Thank you, Dr. P, I'm going to say, for so I can get them all in there. This is such a great idea, Marie Henderson said. And let's see, you did address the one about the challenges, finding evidence. And Marie also said, I can't wait to download the handbook.
Nice.
And Dr. Heather Peterson, as your ADP chair, I am so proud of your work,
Oh,
Marie.
thank you. I was looking
That's
for comment from her.
great.
Thank you.
Yes, that's wonderful. So, and of course, you answered the one about the beach. Beach therapy. I love it. Somebody said beach therapy.
Yes, that is the way it's going for me, I know.
I think I've got them all. Yes, that is everything so far. And again, now that they have your email, I bet that they'll go forward with that as well.
Excellent.
I know that I am going to also look for this handbook myself.
Thank you. I appreciate it.
Absolutely excellent. And of course, I know Ryan said we don't have to thank him, but he was amazing as our tech host. And thank you for that, Ryan. One minute and counting, everybody.
I think we can wrap this up, Laura.
Okay,
Just
good.
thanks for Dr. Pangilinan. Thanks for all the attendees in the session here. Please check out other sessions. We got 2 more days at TLC. Hope you have a great time viewing sessions, learning lots of information.
Yes, thank you, everybody. We
Thank you so
appreciate
much, Ryan. Thank you, Laura. Thank you, Dr. Dillard, and thank you for everyone who attended. I really appreciate your presence, and definitely a shout out to Dr. Heather Pedersen and Dr. Dallas Stout, who were my who worked on the ADP with me. Thanks again.